Hello and welcome. My name is Renata Drayton and I work for the Injury and Violence Prevention Branch of the Department of Health and Human Services here in North Carolina. I will be presenting to you a series of short clips about injury and surveillance data in North Carolina. Today's topic is poisoning, specifically prescription drug overdoses. Prescription drug overdoses are a rapidly growing public health concern here in NC. All substances are considered to be a poison. The right dose differentiates a poison. A poison is anything that can harm someone if it is used the wrong way, used by the wrong person, or used in the wrong amount. Examples of poison include, but are not limited to, over-the-counter medications, prescription medications, alcohol, carbon monoxide, and illicit drugs. According to the CDC, each day, 46 people die from an overdose of prescription painkillers in the U.S. In 2012, healthcare providers wrote 259 million prescriptions. That is enough for every American to have a bottle of pills. The South houses 10 of the highest prescribing states. In 2010, enough prescription painkillers were prescribed to medicate every American adult around the clock for a month. Annually, there are 15,000 deaths in the U.S. from prescription drug overdoses. In the U.S. since 1999, there has been a 400% increase in prescription overdoses. 48,000 women died from prescription overdose between 1999 and 2010. Methadone is a medicine used to treat the cravings and withdrawal symptoms of drug abuse. It is also important to note that methadone is also used to treat pain. Methadone contributed to nearly 1 in 3 prescription deaths in 2009. About 5,000 people die every year from methadone overdose. That's 6 times as many people in 2009 than a decade before. This graph shows that overdoses due to opioids have increased tremendously. An opioid is a type of narcotic pain medication. Opioid drugs work by binding to opioid receptors in the brain, spinal cord, and other areas of the body. They reduce the sending of pain messages to the brain and reduce feelings of pain. Opioid overdoses have driven the surge in overdose deaths and surpasses benzodiazepines, heroin, and cocaine. For every 1 opioid overdose death in 2010, there were 15 abuse treatment admissions, 26 emergency department visits, 115 who abuse or are dependent, 733 non-medical users, and amounts to $4,350,000 in healthcare-related costs. This map displays the number of painkiller prescriptions per 100 people. As you can see, the southern states have the highest ratio of painkiller prescriptions prescribed to number of people. From lowest to highest, this image depicts the different levels of painkiller prescriptions prescribed by healthcare providers. This map displays the overdose rates by state. The darker states have overdose rates significantly higher than the overall U.S. rate. Taking a look at injury deaths in North Carolina, unintentional poisoning ranks number 3 in leading causes of injury deaths. Out of 5,992 injury deaths in 2013, 110 are due to unintentional poisoning. Using the injury iceberg for drug poisoning deaths in NC, we can see that in 2012 there were 923 deaths, 3,624 hospitalizations, and 7,881 emergency department visits. The amount of outpatient visits and non-treated causes are unknown. These numbers have surged higher this year in 2014. In North Carolina, drug poisoning deaths are more prevalent amongst males than females. It is also more prevalent amongst Caucasians. This map displays the number of deaths per county compared to the number of opioids dispensed. Notice the counties with the large number of deaths also had a large amount of opioids dispensed, represented by the very large dots. North Carolina gathers surveillance data from different sources and systems. Here are some of the sources used to gather data on unintentional poisoning. Thank you for tuning in. For more information about poisonings and unintentional prescription drug overdose, please visit our website at www.injuryfreenc.gov or contact our office at 919-707-5425.